Good morning, everyone. My name is Neil Mercado, reporter for INQUIRER.net. What started as a pneumonia of unknown cause in Wuhan in China has now become a global pandemic and is now known as the coronavirus disease or COVID-19. It has also reached the Philippines, and more cases of COVID-19 are confirmed here on a daily basis. As of Wednesday morning, March 25, there are 552 confirmed cases of the disease in the country, as per the Department of Health. This has prompted the Philippine government to enforce measures in an effort to prevent the spread of the disease, such as the enforcement of an enhanced community quarantine over the Luzon region. In early March, the first COVID-19 case involving a Filipino was confirmed in the country. He was known as COVID-19 patient number 4. He joins us here today. Good morning, Mr. Carlo Navarro. How are you, sir?
Good morning, Neil. I am very good today, and thanks for this morning's interview.
Thank you, sir, for accepting our invite. So, sir, how are you right now?
Uh,
Aside
I'm feeling a, I'm feeling a lot better. No symptoms. I'm trying to normalize my life again. And I'm here in my own place, quarantined for the next 14 days.
why are you still quarantined, sir?
My test results have not really come out, so I'm still waiting for the negative confirmation, for the confirmation for a negative test result from RITM. I couldn't follow up because I know that they are actually extremely clogged right now. So I'm just waiting for the test results here in my own place. Doctor released me after I didn't show any symptoms and that my pneumonia has improved a lot. So they said I can do self-quarantine at home.
Mhm. Okay, so when are we expecting any date for the release of your results?
To be honest, I have no idea on when that result will come out. I've heard from friends who are also waiting for their test results that it has been 2 weeks now, and they have not heard of their test results.
Mhm. So, sir, like what I said in my introduction, this disease started as a pneumonia of unknown cause before it suddenly became this global pandemic that it is right now. So, sir, what was your reaction upon hearing the news about this new strain of coronavirus that was discovered and is now and at that time was just threatening the whole world, including the Philippines?
Actually, if you look at the study conducted in Ireland or Iceland, they have found that the virus is mutated 40 times, and they've actually seen 40 different strains of the virus. Uh, I think early on it has been confirmed that this virus is slippery, meaning it mutates fast. And of course, I'm concerned because if the virus continues to mutate, then that would need probably different types of medical intervention. And we do not know how strong this virus can go if it continues to mutate further.
Mm-mm. So, sir, now the question is, you were identified as patient number 4 later on. Now, do you have any idea, sir, how you got this disease, sir? How you were infected by it?
We have our suspicions. I think it was on our way back from Japan um, when we were on a plane back to Manila. There was this Filipino man behind me, seated behind me, who was coughing vigorously. And I think, that might have been the source of the virus.
Mm-mm. So, sir, when did because this I was able to speak with former Health Secretary Manuel Dairi a couple of days ago, and he told me that unlike SARS, this one you can spread the disease even if wala ka pang symptoms that you were showing. How did you figure out, sir,
Mm.
that something's up here?
Um, when I was speaking to my doctors back when I was in our RITM and even in that private hospital, they actually think that the virus cannot be spread unless you have the symptoms. And if you
Mhm.
look at my the history, my experience, after I came back from Japan, it took me another 7 days before I started to show symptoms. All the people that I was in contact with during those 7 days, they were all tested by the DOH. None of them yielded a result of positive. So all of them were confirmed to be negative. Especially my daughter and my and her nanny, who was with me the entire time because my wife was here in Lipa, Batangas while we were staying in BGC. So my daughter, in fact, even before I developed the symptoms, she was massaging my face. So if there were, if there's anyone who would have been exposed, it would be her. But she also tested negative.
Mhm.
Because what I did is after getting tested and while waiting for the results, they were immediately isolated. There were no contact between all of us, and among us. And then so I think that isolation is very important once you have to, develop the symptoms. So I believe that the virus cannot be transmitted unless you cough, you sneeze, and then you touch anything around you.
Mhm, mhm. So sir, what were the symptoms that you experienced na pushed you to have yourself tested?
Initially, I had I had chills, and then but no fever. I was around my temperature was around 37.7 that night until I got tested the following morning, and it was 37.9. I had a severe dry cough. It was very difficult because I couldn't sleep that night because I kept on coughing. And those were the symptoms, preliminary symptoms. And then as I go through uh, my first 3 days, started having muscle pains all over my body. And then on the fifth day, I started having diarrhea, and I started to vomit everything that I eat. And that was the time that the doctor confirmed that I have developed pneumonia while I was in the hospital. And then the fever returned. It was 38.5, but we were able to bring it down, my temperature down immediately. Um, so those were the symptoms that I experienced in the entire course of the that I had the virus.
Mhm, mhm. So sir, I from what I understand, please correct me if I'm wrong. You were brought upon having confirmation that you are positive of COVID-19. You were brought to our ITM, right, sir?
Yes, immediately, because when I got tested on March 4 morning, DOH called me on around 11 p.m. On the same day to say that the test results are out and I am positive, and that they need to bring me to RIATM for isolation. So the evening of March 4, I was immediately picked up and brought to RITM. But I checked in around March 5, 1 a.m. because it took us 2 hours before I could get to Alabang.
Sir, can you paint us a picture? Ano yung itsura, ano yung what was it like doon sa ano yung situation doon sa hospital when you arrived there and during your stay there?
Because I was the first case, when I arrived there, it was still, a lot of rooms were still vacant, except for that other, that patient number 5, who came from Green Hills. He was already there, and he was in ICU because his case was more severe. Um, it was scary because the entire hospital was really deserted. Uh, because they also fear, so very few people, just that one nurse and one doctor who waited for me outside, brought me to my room. Once you're in the room, you only have one, very simple. It's a very simple room. It's a bed and a toilet, and very small. It's a negative pressure room, meaning the virus cannot go out because of that negative pressure.
Were you, sir, were further tests conducted sa inyo? May mga binigay bang mga gamot, ganyan, sir?
Yes. Every other day, I get tested for COVID-19. And
Mhm,
for 4 tests that they have conducted, it all turned out positive. And then at first, they were only administering Sinicod, which is a cough medicine to remove the cough. But when I started having having pneumonia, that's when they administered chloroquine and another antibiotics. However, I must warn people that they should not buy chloroquine on their own. It has to be administered by a doctor in a hospital. It has side effects. You cannot take it as a preventive measure. It will have to be given to you only at a certain point when the disease or when the virus progresses. You cannot buy this from pharmacies by yourself because you will need a doctor. Sabi nga, then they said it has side effects. So if your body is not strong enough to take that medicine, it could have side effects.
Mm-hmm. So, sir, if I remember it correctly, the first three cases were confirmed here in the Philippines, and then you were patient number 4, and then sabay kayo, I believe, kinonfirm ni patient number 5. And then, between dun sa confirmation ng 1, 2, 3, and then 4 and 5, merong kaunting, kumbaga, delay hindi man delay, how do you say this? Merong bakanteng time doon sa confirmation between 1, 2, 3, and then 4 and 5. So, sir, as the first Filipino na nag-positive dito sa case, you said it yourself, sir, nung nakarating ka sa ospital, wala pa masyadong bakante. You saw it na doon nag-start yung surge. Dumating, napuno ang RITM, sir. Dumami yung mga dinadala sa RITM, sir. Ano feel nyo nun, sir, while seeing that happen right before your eyes?
Kasi the nurses were getting delayed in bringing us the food as we go through the days. And they confirmed that there were so many cases that are now in that were not now in RITM. And I think that point in time, I realized that that was because of the change in policy adopted by the DOH. When I was tested, in fact, the hospitals back then wouldn't test me because they said I didn't come from a hotspot country and I'm only considered as a person under monitoring. But because I insisted to be tested, they eventually administered the test, and true enough, I got the confirmation that that was positive. DOH subsequently changed its policy. They did more testing, and that's when the number of cases exploded. I think there was already community transmission even before my case. So the virus was really spreading fast, and that's why that this community quarantine is very important to make sure that we don't spread the virus anymore.
Mm-hmm. You mentioned, sir, there was a change in protocol. So do you think that there were some flaws in terms of the protocols imposed by DOH before before dumami pa itong cases nitong COVID-19 here in the country?
I think what changed was that they tested more people. And of course, if you test more people, you will be able to find out more people are positive. Before, kasi, very little testing has been done. And probably that's the reason why we didn't get any cases confirmed.
Okay, sir. So, now, sir, isa sa mga pinag-usapan natin before we had this interview is yung concept ng stigma. You said, sir, that you didn't personally experience it, but there was this one isolated case, sir, na you experienced it. Can we talk about that a little bit, sir?
Sure. Ever since I came out, I've only received messages that are positive, thanking me for sharing my inspiring story, and that and giving people hope that we can actually survive this virus. Except for one, there was this lady from BGC who told me that I should have not gone to Japan because now I've spread the virus in BGC. We really cannot expect everybody to have positive thoughts about me sharing the information. But the only intention that I came out is to share my experience to a lot of people so that they can get themselves protected. I am sorry that there may be one person who felt that way, but I guess we should avoid this type of negative perception of people who have the virus. We didn't intend to get the virus in the first place. It is something that gets transmitted. I think what we should do is to lend support to those people who have gotten the virus because they need this protection, they need your prayers, and they need your support.
Mm-hmm. Okay, sir. So, sa tingin niyo, sir, paano naman ito maapektuhan yung kasi when people see na okay, ganito yung medyo may tendency to have a negative reception of those who are confirmed of the disease. How will this affect, sir, yung mga tao na hindi confirmed of the disease? Kasi sir, as nasabi ng World Health Organization, we should stop this because uh, some people might be afraid na magpa-test dahil takot silang magkaroon nga ng ganitong reaction from people. What can you say about that?
Um, when I came out, I actually received a lot of messages, and I've been reading them and responding to some of them whenever I could respond. Some of them are actually afraid to go to a hospital for testing because not because of the stigma, it's just because they don't have the money to go to a hospital or to get tested. They also fear that if they have the virus, they don't know if they can handle it psychologically. And this is where I stepped in and encouraged them that you can actually handle it. If you actually go to the hospital and get tested and get a confirmation, it should be, the earlier the better, because you will be able to prevent the virus from further escalating if you get the appropriate attention, medical attention that you need. So um, people actually are not afraid of stigma. It's the expense that they're going to face, and it is also the psychological effect that they may not be able to handle the virus. But I think my story will prove, as long as you believe and you have faith in God, that you can go through this go against this virus, you will be able to survive this virus.
Yeah, so you mentioned about that Facebook post, and I have a copy here. I'm reading it right now, actually. So one of the lines here you said is, "I realized, quote, I realized that ignorance and inaction will cause the virus to spread fast." Can you elaborate that? How important is it for us to educate ourselves as well into COVID-19?
So, see, a lot of people do not know if they have the virus, but they have the symptoms. So, I think the first important step that you need to do is to get yourself tested. That's the only way you can have a confirmation that you have the virus. Because if you don't know that you have the virus and you keep on socializing with people, especially the loved ones that are in high risk groups, the elderly, those with pre existing conditions, you are actually endangering their lives by not getting tested. So you need to get yourself tested and immediately isolate yourself. Isolation here is very important because any contact that you have with those high risk groups can actually endanger the lives of those loved ones.
Mhm. So sir, based on your experience, sir, what is your advice naman, sir, doon sa mga natatakot na magpa-check, na they think they have it pero they are afraid of having themselves checked, sir? What can they do? What concrete actions can they do right now?
If you have the symptoms, you have to go to a hospital and get yourself tested. If the hospital does not have the facility or any testing kits, you need to reach out to the DOH. And if you don't get a response from the DOH, you need to stay and quarantine yourself. Do not socialize with anyone. Even in getting your food and even in getting your medicine, you have to stay away. You need to make sure that no people will be in close contact with you. You need to make sure that to maintain your sanity, you need to continue to pray and to stay close with your loved ones. Do video calls, do calls. Those will help you to survive the virus. And if you have those symptoms, one of the things for cough, they gave me Synecod, and then for um, for my fever, they just gave me a paracetamol. I think those will probably help. But again, don't take those chloroquine or any of those antibiotics without doctor's prescription and without a doctor administering it to you. They need to check whether your body is able to handle the effects, the side effects of the drugs. So I think those are the things that they should remember. Um, Especially if they're scared to go to a hospital, they can actually do some preventive actions by isolating themselves.
Okay, final question na lang, sir. Uh, it doesn't end here. There's still something after this, sir. So what's next for you, sir?
What's next for me? I'm trying to normalize my life. So if you can see, I'm on a work from home arrangement now. I've continued to communicate with my clients because our deadlines are just around the corner. I've been
Mhm.
speaking to my team, approving reports. I've been exercising now. So I just wanted to normalize. After this, I'll be back in the office and I will return to farming because every weekend I do farming and hopefully this virus situation blows over as soon as possible.
Okay, thank you so much, sir. I'm hoping na maganda yung resulta na makukuha nyo once bumalik na sa inyo yung resulta ng retest na ginawa sa inyo, sir.
Salamat, Neil, for giving me the opportunity to share my experience and story this morning.
Thank you so much, sir. Again, this is Neil Arwin Mercado. Stay safe, everyone. This is Neil Mercado again for Inquirer.net.